Vaccine distribution gets a boost and Johnson County rolls back some restrictions. On this episode, hear about the county's ongoing efforts to combat COVID.
Whether you live in or just love Johnson County, Kansas, JoCo on the Go has everything Johnson County. Here's what's happening and what's coming up in the community you call home.
Thanks for joining us for JoCo on the Go. I'm your host, Teresa Freed, a Johnson County resident and employee of Johnson County government. Monday through Friday, the county has been hosting live events to provide updates on vaccine distribution. Those have been a great way to stay up to date on when and where you can get vaccinated. I'd encourage our podcast listeners to tune into those broadcasts on Facebook. We also have them available in a YouTube playlist if you don't catch the live events. Last week, we had Johnson County Department of Health and Environment Director Dr. Sami Ariola and local health officer Dr. Joseph Lemaster on one of those daily updates. And they talked about the increase in doses the county is receiving and also a new public health order that rolls back some restrictions in light of the decrease of COVID cases in our community, as approximately 25% of our population has received a vaccine. So here is some of that conversation.
The goal is to try to increase the number of avenues and outlets where you can get the vaccine. And that's increasing every week. Every opportunity that we have to add additional providers, we're doing that. 18,720 doses is about 2.5 times the size that we were getting for several weeks. For several weeks, we were getting 8,100 doses. So that's huge. We like that. We're happy that that many doses are coming into the county. So we are ready. Our providers are ready. Just before we jump on this call, I was on a call with our PIO, Barbara, talking to some of our partners here, just ensuring that everyone is ready to ramp up and vaccinate. Our residents want the vaccine, and we want them to get vaccinated as quickly as we can. And so we're pretty excited that more vaccines are coming into the county.
All right. And you had a very full morning at the Board of County Commissioners meeting. There was some very good discussion there about some of the progress that we've made with vaccinations, and then also discussion about the local health orders. So if you and Dr. Lemaster can both talk about what action was taken and why.
Well, I'm happy to take that one, Teresa. Joe Lemaster, local health officer for Johnson County. So as probably the press know and the public knows, we've had in place public health orders of two sorts. One is a face covering order that was issued by the governor some time ago, which is Executive Order 20-52, which was specifically focused on face masks. And then we've had in place an additional local health order that was issued by the Board of County Commissioners a number of months ago. That order included some stipulations with respect to not just with social distancing, but also capacity in which people could be in different venues. There were limitations on how many people could, for instance, sit at a table in a restaurant, or what the percent of capacity in a space could be when people were having a meeting. There were also specific guidelines for certain types of businesses like gyms that limited the number of people that could participate in those. The current order does a couple of things. First, with the expiry of the governor's order that was stipulating face coverings, we've reintroduced into the new order, face coverings, very similar to what are the wording that were in her order and what we've been doing right along, with similar types of exceptions, which we can talk about. And we've removed in the new order all of the stipulations with respect to capacity in various retails and other types of spaces. So we no longer have a limit in terms of the number of people that can be in a space in terms of the percent of the capacity or the number of people there. We still, in the new order, include restrictions with respect to physical distancing. So people needing to remain, when they're in public spaces, remaining 6 feet apart, and to wear a face covering when they're not able to do that on the outside, or when they're inside in any kind of a public space at all, with certain exceptions that have to do with a number of different venues, or also whether people have particular medical problems.
And I think the the thing to keep in mind is, and that's part of the basis for our recommendation is we got to where we are because of the diligence of our residents. We did not have vaccines until late in December, but we worked with local health systems and other partners to let our residents understand the importance of wearing masks, physical distancing, avoiding large indoor gatherings, even during the holidays. And all of those really were done at a tremendous cost. People did not typically get together like they would have with loved ones for Thanksgiving, for Christmas. And that's how we are able to get to where we are. And we know the desire to roll things back very quickly. But we also know this is what we do every day. We know the risk that is associated with that, and that's but we try to balance that with the preferences and the feedback from the community. There's no question for us that we know the risk that is still there. We know that there are variants, UK variants, South African variants, all of those that are going around, and we know what could potentially happen if the trajectory changes and everyone stops doing what they've been doing. We're not out of the woods yet. The numbers are not actually falling anymore. They have stabilized. In other parts of the country, they're starting to shoot up, and so there's no vaccine is not at a place yet where it's the solution. It is a part of the solution now. It's a tool in our arsenal that's working for us. It's been very effective in helping us curtail death and hospitalization, but wearing masks, physical distancing continues to be very, very important for the next few months.
And there was some discussion kind of looking forward on a path to further scale things back. Can you talk about that discussion?
Right. So that's really where we get into the the qualitative aspect of what we do. There's what we would like as public health scientists and what we think is ideal. And so, but then you get to a point where you balance that again with other factors in the community. And so we are vaccinating very well. And so the goal to get to where we vaccinate 50% of our population is, to be clear, that's not going to give us herd immunity or this population immunity. That's not what that's about. That's a compromise number. It's a qualitative number that's just saying that's a target that we can reach. And to be clear, the risk with 50% will be slightly lower than when we haven't vaccinated 10% of our population, but the risk is still there. We want that to be very clear. We could still have the trajectory change. We could see again outbreaks. Those are possibilities there, but we're going to continue to do our best and vaccinate people. So right now, the goal that's set is get to where we've vaccinated, giving the first dose to 50% of our population that are eligible for the vaccine. That's the primary goal. And then hopefully measures of community spread, which is incidence rate, number per 100,000 residents, and positivity rate. Hopefully we can keep those down. If those are down, again, while throwing in the caution that testing numbers are down, that would tell us that community spread is still low and we are vaccinating more. Comfort level for us is not going to be where we want to be, but it's a fair compromise in my opinion.
How are vaccines being divided among the hospitals, the regional partners that we have, the pharmacies, and the clinics that we have?
Right. So that's a good question. So the pharmacists currently are getting vaccines directly from the federal government through the federal retail pharmacy program. Of course, we are working with some of them that are for targeted vaccination. Hy-Vee and Urban Pharmacy have been assisting us with vaccinating in independent living facilities. We have some other private pharmacies that are assisting with vaccinating intellectual and developmental disability group. And we, again, have just met with Hy-Vee and have a couple of meetings with other pharmacists tomorrow to look at additional ways that we can expand the collaboration with them. Our health systems have been distributing vaccines a lot. Most of the time depends on their capacity. Some are able to expand, but one thing to keep in mind is, so if health for us, the Department of Health and Environment, we have been averaging slightly over 7,000 vaccinations every week. So between first and second doses. So there are weeks where all we did is give out first doses. And so if we give out 7,000 first doses this week, in 3 weeks' time, the 7,000 second doses will be due. So the number of first doses that we're able to give at that time will be decreased. It won't be as much. You've got to balance those things out with vaccines coming in, and so it's the capacity is not limitless. So there are times when some health systems are able to take more to do more, but they have to balance that out with the number of second doses that they have. So, but they've all worked very hard, and they are continuing to look for opportunities to expand giving out vaccines. We are doing the same.
One of the things that is important to remember about these vaccines is the way that they were developed. So the 95% effectiveness of the Pfizer and Moderna vaccine that are quoted were with respect to preventing severe illness like hospitalization and death. But those studies that they used before and that they presented to the FDA, in those studies, they didn't specifically as endpoints of the studies look at the percentage of people that after vaccination would get infected. Those studies are happening afterwards. So there were some questions today about whether or not it's possible after you've had one dose, after you've had the doses of those vaccines to get infected and pass it on to other people. And that is still being studied. We still don't have the answers for that. The Johnson & Johnson vaccine works a little different. The way that their endpoints were different. It is not an RNA virus based, it's not an RNA vaccine. It uses double-stranded DNA, which is in a sort of cold virus, very typical to the sorts of vaccines that we've used in prior times. The Moderna and the Pfizer vaccines were a new type of vaccine. But we feel that they're all very effective, and we strongly recommend getting any of them. There are no reasons not to get any of them from a scientific basis.
When we have our vaccine clinics, do we have some sort of wait list or a way to contact people, or are we contacting people if we have excess doses that we need to use same day?
Right. We seldom have excess doses. Our clinics are very well planned. And then we also run our clinics with volunteers, so that when there's any remaining, we try to vaccinate our volunteers. But by and large, by the time we get to the last hour or the last couple of hours in our clinics, you will see that the manager is starting to manage opening of new vials. For example, Pfizer is typically 6 doses in the vial. So we're not necessarily asking all 15 or 20 vaccinators to start opening new vials towards the end. We're managing based on how many people we have, how many people we expect. So in many cases, we don't have a lot of doses left, and that's why we don't have any waiting list. If there are any, we typically would give them to our volunteers.
All right. And can you talk a little bit about how we're prioritizing individuals? We've gotten some questions on social media about whether certain health conditions are putting people at the top of the list, or if it doesn't matter.
It doesn't matter. We are the only thing that's limiting right now is the number of appointments. But as more vaccines are coming in, there will be more appointments. We also don't want you to come in with your medical record or anything. We don't want to see it. I don't want you to come with your medication bottle. We don't need to see it. When you are booking for the appointment, obviously there's a honor process to it, but it would tell you whether you qualify. If you book an appointment and you are a Johnson County resident or you work here, we'll vaccinate you.
Okay, we have another question on social media about how homebound residents are getting vaccinated and who do they reach out to initiate that process?
Yeah, that's one process that we are very proud of. We have a team that's going into the homes that's vaccinating up to 30 people every week and taking vaccines to them. So if you, and I think, I know that our area agency on aging is also reaching out to the program where they take food to people's homes. And so they're reaching out to those to see who needs vaccination and coordinating with our team to go into the homes and vaccinate them. So the question about how do you reach out to us, email us, jcdhe@jocogov.org or call us 913-715-2819 and our staff will assist you in getting you registered, and if we need to bring vaccine to you, we will do that.
Do you want to talk at all about the regional partners and health systems and how they're kind of coordinating prioritization of patients?
That's a really good question, Teresa. So we participate in a regional coordinating group that is, usually we call it the MAC group, which meets every other Tuesday, and we keep a very close eye on what is going on in terms of the progress of the pandemic, in terms of new cases and hospitalizations, as well as the vaccine distribution. We have a number of regional partners in terms of hospital systems that are also receiving the vaccine. Recently, they've been receiving that vaccine through us, at least the ones that are in Johnson County. Wyandotte County operates a little bit differently, as do the other counties around the state. All of the counties are receiving vaccine from the state. However, there's a distribution system that happens from the state. And the different regional partners, for the most part, are what's happening is that healthcare systems are coordinating with the counties in each instance to be able to work out who will take responsibility for vaccinating, for instance, the patients within the healthcare system versus those that are not in a healthcare system and have to get it directly through the county. Things are quite different in Wyandotte County. They have some walk-in venues where people are going who are within the criteria for receiving vaccine that work a little bit differently, but in generally it's pretty much the same kind of issues both in any of the counties within Kansas. Now, when you go over into the Missouri side, things are a little different because they're in a different phase than we are. So different patients, different types of patients are able to get the vaccine in the same way. But through different partnerships or at different in different phases, so that not the same people are eligible in Missouri necessarily exactly as are in Kansas. But generally, we're progressing about the same level. We're somewhere in the neighborhood of 22 to 25% of the population that's eligible that's been vaccinated. So it's working, I think, in both states and on both sides of the line.
So be sure to stay up to date by listening to our Facebook Live events held Monday through Friday. So on Mondays, Tuesdays, Wednesdays, and Fridays, that's at 4 o'clock and 4:30 on Wednesdays. You can also visit jocogov.org/coronavirus for much more on the virus in our community. Thanks for listening.
You just heard JoCo on the Go. Join us next time for more Everything Johnson County. Have a topic you want to discuss? We want to hear from you. Follow us on Facebook and Twitter at JoCoGov. For more on this podcast, visit jocogov.org/podcast. Thanks for listening.